Welcome to Ostomy 101. My name is Dawnette and I have an ostomy. I'm here with Star Harrison. She is a wound, ostomy, and continence nurse. And today we'll be discussing pouching options. There are hundreds of different types of pouching systems and many different variations and several different manufacturers. But before we get into that, Star is going to share with us how a CWOCN sets us up for success.
Yes, a properly fitted pouching system improves the quality of life of a person with an ostomy. There are different considerations. Number one, the type of ostomy, whether you have a colostomy, an ileostomy, or urostomy. A stoma type could be your loop and or budding and flushed stoma. Abdominal contours. Lifestyle could be Danette, you surf, and that's something to be considered so that you will continue to be able to surf after surgery. And then the visual, were you able to see the pouching and be able to take care of it? And then lastly, the dexterity, will you be able to open and close your pouch head or be able to actually snap and unsnap the two-piece if you chose to do that, if that's your personal preference. An appropriate pouching system should be chosen by a licensed wound ostomy nurse before your discharge so that we can get you set up just in the right place right before you leave the hospital.
You mentioned personal preference, and this is a segment that's really important to me because after my surgery, I was fitted with a product that worked just fine. It was a quality product, but it really didn't fit my lifestyle. It was a personal preference for me. And part of me coping with having a permanent ostomy was being able to find a pouching system that I was comfortable with. It's important to know that hospitals can't provide every different kind of pouching system in every size from every manufacturer. It's just not realistic. So what do they do, Star?
So usually every institution will have a contract with a manufacturer with one quality product to provide you.
One of the challenges I faced as a new ostomy patient was that I had trouble finding these manufacturers and connecting with them. I spent a lot of time on the internet. I didn't have maybe the vocabulary that I needed to be able to connect with them. One of the things that we want to do with Ostomy 101 is to help you more easily connect with these manufacturers to find the products that you might be looking for. Most manufacturers will send you 1 or 2 free samples for you to try, and they're motivated to do this because their own research shows that once you decide on a product, the chances of you ever changing again are very slim. But I think it's important when you call to tell them what you're looking for. Are you looking for something a little bigger, a little smaller, clear, opaque, 1-piece, 2-piece, drainable, and we're going to talk about all of those things here in a minute. But that helps them find a product that's going to work for you.
And you know what else is important is to tell them the stoma size that you have when you do call for samples. Many of my patients are confused between a manufacturer and a supplier. Can you explain that, Jeanette?
The way I explain it is if you have the Ford Motor Company and they are making cars, that's typically not where you buy them. They're the manufacturer. You go to a dealer to buy them. And that, in our case, would be our supplier or a provider. So although the manufacturer can send you a free sample, you can't buy your monthly supplies from them. You have to go to your supplier. And how you find out who your supplier is by contacting your insurance. And they should give you a list of 2 or 3 different suppliers that you can contact. Just about every pouching system comes in your choice of clear versus opaque.
The Danette at the hospital, they will always be started with clear so that the clinician can monitor the output and the type of output they have.
In addition to clear and opaque options, you also have a drainable end or closed pouch. And Star, you have
with the spigot for urostomy.
There are 2 different kinds of skin barriers. This is a skin barrier that detaches from the pouch and snaps back on like Tupperware. And what do you have there?
And this
Star?
is a 1-piece where the skin barrier attached to the pouch. So it's all together, very low profile.
Star, there were some other things that you wanted to add about skin barriers. And skin barrier, you're talking about the piece that actually sticks to us, right?
Right, the one with the adhesive. And then the skin barrier have two types. One with a convexity and one that's flat. And that means with the convexity is where the adhesive side, there's a curvature. Whereas the flat, the adhesive side is practically touching the skin.
Completely flat.
It's completely
so you can
flat.
see that this one has a little bit of
The difference between the two.
Can you explain when we would need to use a convex skin barrier versus a flat?
Okay, so an uneven peristomal plane, and that means lots of divots, crevices, or any scar tissue around the
Dips and
stomach.
rolls on our belly, right?
Yes, and then a retracted stoma.
One that's flush, completely flush
Right,
to our
right.
abdomen.
And then the suboptimal location of the os, which is the opening of the stoma.
And that's where the Oz is where the stool or urine comes out.
Right, and if that's buried down at 6 o'clock or 3 o'clock, that will require convexity. And lastly, some loop ostomy. Again, that has to do with the os, where it's located. And then unacceptable wear time. If you're leaking less than 24 hours, then that's requiring a convexity as well.
And that would also be a good time to go see your ostomy nurse, right?
Right, exactly. So then you can be guided properly for the pouching system.
I understand that convex skin barriers come in different depths.
Yes. So that has to do with how deep is the curvature of the convexity. It could be light, medium, or deep. And that adds to also the flexibility. Some of them are firm and soft. And if you have a new ostomy, you want the softer one because you want to protect the space between the skin and the stoma so you don't have any kind of mucocutaneous separation. And that's really important to consider when you're choosing convexity.
Star, this is a high capacity output pouch. When would we use this?
So this one with a high volume output, such as a high ileostomy output or fistula that has a high volume that needs containment.
And it's longer?
Yeah.
It's longer and a little bit wider, too.
Correct. And this particular one has a wider skin barrier so that it would also accommodate stoma that is larger.
And this is a urostomy pouch, but Star, you're going to show us what to do at nighttime, right?
Yeah, so at nighttime, you're going to unplug the spigot or the tap opening and attach it to a urostomy nighttime collection bag. And this will allow you to be able to sleep through the night and give you that quality of sleep.
So you don't have to keep getting up and emptying.
Right, and you don't have to empty it every 2 to 4 hours at nighttime.
And finally, filters. These pouches have filters, and you can get just about any pouch with or without a filter. It's your choice. The idea of filters is that it releases gas that might be trapped in your pouch. But when they get wet, they don't work very well. You may have noticed inside your box of pouches comes these little stickers, and the stickers go over the filter so that you can shower, you can swim without it getting wet. Another important thing to know about filters is if stool gets stuck on top of the filter on the inside, it won't work very well either. So you just have to try fit with filters or without and see which one works best for you. The manufacturer's contact information will be listed on the Ostomy 101 website and on the Ostomy 101 app. But while you're there, be sure and check out some of the manufacturer's free recovery programs. They're excellent.
And if you're having a pouching issues, contact your local wound ostomy continence nurse so that you would be able to address that and get help with whatever is going on with your pouching.